Hello, and thanks for tuning in today to our webinar about how SecureMail helps your COVID-19 comeback. Today, we're going to talk about how SecureMail helps your COVID-19 comeback. With me is Mark Ayer, Director of Customer Operations. Mark, are you there?
Yes. Hi. Good day, Jeff.
Hi, Mark. So we want to make sure we have enough time. Mark's going to take us through a demonstration of how to actually use SecureMail in the ways we're going to suggest here today. So I want to start diving through. We're going to talk about patient engagement a little bit, how to get patients engaged with SecureMail, how it helps you, how it comes above other tools that people might be using, and specifically, around the idea of HIPAA compliance because it's so important, especially now. We'll talk about why. We'll talk about engaging patients and increasing satisfaction. Mark's going to take us through, as I said, a demonstration. We're going to try and spend as much time on that as possible. We're looking at some additional resources you can use for follow-up, things around privacy compliance, things around how to use SecureMail, different tips and tricks, and where you can find those. And then, of course, the winners of the draw, which is always the most important part. So really, in today's healthcare world, healthcare has lagged behind. Certain parts, certain areas of healthcare more than others, and some less so. And it really is about technology adoption. Part of the problem that we run into in healthcare is that privacy compliance is so important. And what that means is typical ways that we communicate in other areas of our lives, in business, personal life, don't have the same requirements that healthcare technology would. So using things like email, like texting, that sort of thing isn't compliant with privacy regulations for lots of reasons. But there's lots of other options out there, and SecureMail is certainly one of them, that gives you very similar functionality, or in fact, in many cases, enhanced functionality over those types of services, and the protections that you need for healthcare. So saying that, patients are used to using email, they're used to using text-based communication, and that's how a lot of communication is done these days. We don't talk on the phone as much anymore. We don't check our mailboxes as much as we used to, and we certainly don't receive faxes. But if you look at it, how we're still trying to communicate with patients in healthcare is still a bit behind the times, right? We mail them appointment reminder postcards. We send out flyers in the mail about, our back to school services, that sort of thing. That stuff is easily ignored, and you get a stack of flyers in the mail every Monday or Tuesday, as I do. That typically goes right in the recycle box, unless there's something in there, like a pizza flyer, or something that I might use next week when I'm pushed for something to find something for supper. So miscommunications hinder patient care and satisfaction. If you're not being noticed by your patients, they're going to forget about you. They don't have the same feeling of like, oh yeah, I have a connection with that clinic. And unengaged patients are more likely to no-show or never rebook, right? If we're not engaging with our patients, we don't have the same loyalty factors as we would if we're sort of always present, even in the background, offering some sort of helpful advice or some follow-up or providing some referenceable material. Engagement builds loyalty. So statistically, patients forget 30 to 80% of what was discussed during an appointment. So in the world of dentistry, hey, here's some things I want you to do with your oral care regime. You should do this and this because we're seeing issues on these areas of your gum line, and that's because of this and this, so let's make those changes. And if a patient forgets that once they're in their car and driving home and listening to their next podcast, then they come back in 6 months and they haven't done it and it's worse, right? And then that's typically going to fall on the dentist because, hey, you're not doing your job, but really patients need to be doing their work as well. And we always say, healthcare gets better when everybody's working together. Patients have a responsibility, but a lot of times there's some change management there that needs to happen, and enabling patients to help make that change and providing them with information in a referenceable way is a big way that we can do that. Same back to getting those flyers in the mailbox. Patients can feel overwhelmed getting a stack of here's some brochures that you need to look at. Maybe we're looking at some braces or some other appliances that need to be put in place to help fix things, realignments, that sort of stuff. That stuff, I know for me, I always sit maybe on the passenger seat of my car for a couple of weeks before I maybe throw it out. The other thing is office hours, right? People are busy and they're working. nowadays, not everybody's back in the office in their cubicles. But when people are in the office or even working, it's hard to find time to call their healthcare providers. Secure Mail helps with that. Secure messaging, people can message you anytime, know that it's safe, know that you'll get back to them when they can. If a question pops in their head at 10:30 at night as they're falling asleep, they can just pick up their phone and quickly send you a quick message about it. And not have to worry about trying to remember or find time in the day to get in touch. And as I said, consumer grade technology is not compliant and is actually dangerously insecure. So things like ransomware, and we'll get into that in a second, cause a big problem when we're using email. Text messaging is really not acceptable for use in any kind of healthcare environment if you're sending patient information. Mark, any comments on that before we move on?
I'm glad you asked, Jeff, because one of the things that often comes up when we talk about Brightsquid Secure Mail is, why not just use regular email or SMS messaging or other services for patient engagement? And you've already mentioned that they're just not secure. They don't meet the minimum requirement for compliance. And I could talk for hours about why email is so insecure or why SMS messaging is such a problem. But it's so baked into what we do here at Brightsquid with Secure Mail that often we kind of gloss over it. But it's so important to remember that meeting the compliance regulations, whether it's HIPAA compliance in the US or some other compliance regulations in other jurisdictions, that's a duty of care that no one can overlook. And that's about all I wanted to say on that.
Yeah, no, you're absolutely right. And I think especially under HIPAA, some people get confused because there's a line in HIPAA when it starts talking about email that says you can use email, and there's a period, and then there's about 3 more paragraphs after that that say if you do all of these things and the email meets these requirements. So that's no excuse to use email just by not reading the rest of what it says. Secure Mail does help with that. Now, the other important thing to note here is that patients want their privacy protected. Almost 100% of patients, when we do surveys, when governments do surveys, these are the numbers that come up. And there's lots of good reasons for that, right? There's risk to patients, identity risk, financial risk, social risk, all kinds of stuff if their private information gets out. 93% of patients expect email communication with clinics. So Secure Mail, and other services like it give you the ability to provide that service and that connection in a secure way that feels like email to the patient because it functions much in the same way that email does at an interface level. 80% of patients want to be included in conversations between providers. So when you're sending out referrals, that kind of thing, patients like to be aware of that. They like to be, have visibility into those conversations because it helps them be more engaged in their healthcare so they can be better patients. We do know that 75% of patients don't feel comfortable using traditional email with their clinics for the privacy reasons stated above. And when we ask the hundreds of thousands of patients that are using Secure Mail, 60% of them want to connect with their dentist through Secure Mail. So 2/3 of people want to be connected with their dental clinic using a Secure Mail service. We talk about the increase in ransomware threats. There's a few different ones here. We've got, because of COVID-19, because of the shift in workplace environments, a lot more people are working online. Cyber criminals have used that as an opportunity to be more present in the environment. So we see a huge spike in ransomware attacks and phishing attacks. And if you're connected to patients through email, a lot of those types of attacks, once they get in somewhere to someone's computer, someone's network, someone's accounts, they will get into their contact list and blast out a message that appears to come from that person. So it looks and feels kind of safe to the recipient, but in fact, it's transporting a virus that shows up into your clinic. So you want to make sure that you're not exposed to that by limiting your use of Secure Mail with patients because cyber risk is becoming so prevalent.
And it really opened up. It was like a perfect storm when the COVID-19 pandemic began because so many people started working from home, so they were on home devices that are less secure. They were distracted because, oh my goodness, they've got their kids at home and everyone's busy trying to manage all that. And at the same time, everyone's trying to implement new remote communication strategies to stay in touch with their patients. Like it was just a perfect scenario for the bad guys. And if without the right protections in place, it was as you pointed out, there was a tremendous leap in ransomware, and I think it's easy to see why.
Yeah, and it's a good point, Mark. There's a huge increase in urgency, right? And because of that, if you look at the statistics on ransomware, I think at the end of 2018, the average ransomware attack cost about $12,000, the ransom demand. By the end of last year, it was about $84,000. And I know it's gone up to, I've seen stats that say it's about $112,000 just for the ransom. And then you can add a couple 100,000 on top of that for additional recovery costs, paying IT, downtime, all that kind of stuff. So SecureMail blocks ransomware, so that really helps with that. And it gives you the convenience of connecting better with your patients. That's really the point. So I want to get to the demonstration, but I want to get through these slides too. So SecureMail is about convenience and compliance. So patients know how to communicate with that. They have their phone, they're using text-based all the time. It is HIPAA compliant, so that keeps patients safe and secure. Additional features, Mark, you're going to go through, I know, read receipts, shared inbox message recall, and it's easy for them to look for follow-up. Like you said, any kind of changes we want to see in their routine. Here's what you should be doing. This is what we talked about. And if they have any questions, they can shoot them off or say, hey, I'd like an appointment or that kind of thing. We set up SecureMail as a virtual front desk. So what you can do is you have a clinic inbox. That means patients send a message to your clinic instead of an individual at your clinic, which has a number of benefits that Mark will go through. But what that means is all of your staff at the front desk have access to the shared inbox, just like they have access to your phone. When a patient calls your clinic, they don't know who's going to answer the phone, but they know it will be answered. Same thing for SecureMail, and if need be, any patient inquiries or queries can be sent off to the doctor for answers, and the doctor can, if appropriate or if necessary, communicate directly with the patient. Now, it's all about fitting the patient schedule, right? We don't have to align schedules with phone calls if they have questions. We can just kind of respond as convenient, as long as it's a non-urgent concern. That's, email, we know, everybody knows it's not something that we're going to get a response necessarily right away. Sometimes we do, and that's nice, but it's not an expectation. Sending appointment reminders from a clinic standpoint, there's read receipts, and you can see that people saw them. So when they say, oh, I didn't know I had an appointment, you can look and say, actually, you saw the reminder yesterday, so you did know. And they feel more engaged, right? It's a better connection. This illustration shows, because patients can use SecureMail with all their different providers, it's a way for them to centralize their healthcare information and communication, rather than using a different system for every clinic, because that's what's convenient for the clinic. We've worked really hard to make SecureMail convenient for everyone, including the clinic and the patient, so that it's easy to use. And for the practice, there's a whole host of benefits, from decreased phone traffic, so we're less frantic. The pace is sort of slowed down a little bit. We know clinics that have reduced the time it takes for them to assemble and send off a referral by 75%, so down from 15 minutes, say 15 to 20 minutes. If it's a paper thing, they're stuffing envelopes, printing off scans, all that kind of stuff, to just simply a couple minutes to attach a few files to a message, type a quick message in there, and hit send. We do also see clinics that have saved literally $1,000 or more every month in consumables. So if you're printing off images at high resolution, that's a lot of toner. And if you're putting a lot of letters in the mail, 9 by 12 envelopes or bigger, you're spending a lot of money on stamps. So we have clinics that were spending hundreds on printer ink and hundreds of dollars on stamps. That cost went away overnight just by switching all of that to SecureMail. It allows staff to better organize and prioritize their day. And we've also seen staff retention go up in clinics that implement SecureMail, because staff is more satisfied, they're allowed to do their time, and we see fewer missed appointments because you're able to have a stronger connection with the patient. Now, let's get into the meat of things, and Mark will show you how all this works. Mark, do you want to take control here?
Yes, sure thing. Just turning on the screen broadcast now, and any second now you should be able to see what's on my screen. So Jeff, that'll be coming through in a moment. Okay, perfect. So I'm going to take just a few minutes here to show you a couple of the features of Secure Mail. Now, I think everyone here has already had some basic exposure to the service. I won't talk too much about the basics, but when I've launched the screen broadcast right now, I'm already logged in as a staff member at a clinic. And I'm viewing, as you can see here, what we call the shared inbox. Now, we configure the shared inbox to act as the virtual front desk. Now, Jeff alluded to that being similar to the way your phone system works, because when your patients look you up on the internet or in the yellow pages, if they're old school, and they dial the phone number, they're not expecting to get the doctor on the phone. They're expecting to be handled by someone at the front desk. And that's the virtual front desk that Secure Mail represents. Now, it's a little difficult to demonstrate because it's a kind of a visual thing, or a non-visual thing, I should say. But I'm logged in as a staff member named Clara right now. And Clara, along with her coworkers, Jimmy and Jeff and another guy named Dave, are all responsible to monitor messages that come into the shared inbox. And we can very specifically route messages to the shared inbox as opposed to routing messages to a specific person, which is how most email accounts work. Now, the reason why that's so important is, as Clara, I might send a message to Adam. That's the patient here that sent me a message you can see on my screen right now. Clara might send a message to Adam that says, don't forget to do X, Y, and Z. Call us back on Friday or whatever. And then Adam responds the next day, but by that point, Clara's gone on vacation. So if that message has come in only to Clara's private inbox, unfortunately, no one's going to see that until Clara's back from vacation. But by routing responses back to the shared inbox, whether Clara or Jimmy or Dave or Jeff are on the shared inbox that day, Adam will get a response in a timely fashion. Sounds really simple. It's so important when it comes to patient engagement, which I think is fairly self-evident. So in this example, I've got this message from Adam. Now, Adam has, judging by the message he's written here, he had a molar pulled recently, and he's having some real discomfort since that happened. Now, certainly he could have, jumped in his car and driven down, but he's taken the effort to actually send a photo of the affected area. So he's taken a picture with his phone, presumably, and then sent the message back to the doctor's office through Secure Mail. This is a very common use case of our service that patients love the ability to be able to send a picture of something, whether in this case it's a something on the gums, maybe it's a rash or an injury on a specific body part, and they just want to send it a quick note to ask, what should I do about this? Now, very often that may result in, let's set up a conference call, let's set up a Zoom chat, or maybe you need to come in and have this looked at in person. But if even just a small number of those responses can be handled remotely through Secure Mail, it frees up the resources of both the clinic, but also the patient themselves. And that's where the patient satisfaction really comes from Secure Mail, because patients don't have to drive down to the office every time they need one little bit of information. They can get that information remotely through Secure Mail. Now, Secure Mail as a secure compliant system is available to our subscribers, and our subscribers can invite people to use Secure Mail for free to interact with their clinic, for example. So as a doctor's office, which I am in right now, I can send a message to a patient, and whether that patient is like Adam, who's already a Secure Mail user, or I need to send a message to someone new who's never used Secure Mail before, I can do either very, very easily. So I just clicked on the Compose button, and I'm now addressing a message to someone. So let's say I want to send it to Adam. As you'd expect, as with regular email, I just type in Adam and he pops up in my autocomplete because Adam's on my buddy list of recently contacted patients. But if I need to send a message to someone else, maybe someone who's never used Secure Mail before, I could do this. So I'll put in their full email address. And you can see that as I'm typing this email address, it says searching recent contacts or no match in recent contacts. So that's telling me that so far, the data that I've typed into the to field doesn't match any known user on the Brightsquid system, of which there's about 200,000. Jeff, you can correct the actual number if you're so inclined, but it's around 200,000 users.
Close enough.
Thank you. So at any rate, this test user 6 at brightsquid.com clearly doesn't match any of my recent contacts. click the continue button, search the greater Brightsquid community. If we still don't find test user 6, well then now we can invite him or her to become a Brightsquid secure mail user. Now I should point out that I'm using a brightsquid.com email address just because that's what I have access to. You can use any email address. So whatever your patient's email is, whether it's Outlook or Hotmail or Gmail or Yahoo or what have you, any email address is fine. I just use Brightsquid because obviously that's the email address I have on hand. So we'll invite this user. When we invite a new user, we are asked to identify our relationship to that person. This is pretty important because they're either going to be a patient, which will give them a certain set of tools, or potentially a colleague at another practice or a new coworker within my practice. But for the purposes of today's demonstration, we'll select patient. When we identify someone as a patient, I'm asked to enter that patient's date of birth. And this is a temporary password, if you will, because the password is a shared secret between both the patient and the doctor's office. Patients all know their birthday. You generally have patient information in your records, so it's very easy to add this person and compose a message to them. Now, when when test user gets this invitation in their regular email inbox, they'll be asked to identify themselves, and the challenge question is going to be, what's your birthday? Then they'll be able to log in and view whatever information it is I'm about to send here. So I'm just going to call a subject line. We'll say post, surgical care, and then, dear Adam or dear Jeff, let's say. And then I'm not going to type too much more because it takes too long, but I could say something like, good to see you on Thursday. Surgery went well. Doctor has no concerns, but please see the attached document with the instructions on how to care for your surgery site. So I can now attach a file that I'm going to send off to this user. And when I click the browse button here, as you'd expect, a little pop-up window shows up, and I can find the specific file that I want to send to our test user. So in this example, I'm just going to grab this PDF document. If I wanted to, I could attach additional photos, but I'm just going to attach this one PDF document and then click send. So then what happens is our test user gets an email notification in their inbox that says, your dental clinic has sent you a secure message. Click here to go and see it. And there's always that regular email notification in their inbox, whether it's their first message or their 1000th message. There's always going to be an email notification letting someone know they've got a secure message so they don't have to keep checking. They'll be notified. Their phone will ding and they'll look at their message and be able to view or download whatever information the doctor has sent. So we'll send that off now. So that's the process of manually sending a message and an invitation to a patient, inviting them to join Secure Mail. Now, I did this, as I mentioned, very, very manually. I typed in the email address, I typed in the date of birth, I composed a message, and I clicked send. That's not the only way. We can actually automate that process to import all of your patients at once into your Brightsquid account. It's a very simple process. Our support team can help you with that. And it's simply a matter of taking a list from your EMR, your practice management system, whatever that system might be, and importing it into Secure Mail and effectively automating that invitation process that I just did manually in this example. And that can be affected for you, at setup or once a month or twice a year. Whenever you have new patients you want to add into Secure Mail, contact our support team, which I'll talk about in a minute, and we can take that task on for you to save you some time. Now, before I turn this back over to Jeff, I wanted to talk a little bit more about the virtual front desk, because in this example, I showed the shared inbox, but really to get the sense as to how this works, if I go into settings and I go into clinic members, we can see here that in this particular practice, there are 4 members. There's our 2 doctors, Dr. Crichton-Brown and Dr. Fauchard, and then there's our 2 staff members, Clara and Jimmy. Now, the way that it's configured right now, everybody gets notified of messages that come into the shared inbox. As you can see, we have everyone here checked on to use the shared inbox. But you know what? In actual practices, in most cases, doctors are not part of the shared inbox because they're busy doing, doctory stuff. So this should really be configured in such a way that neither Dr. Crichton-Brown nor Dr. Fauchard are going to have access to the shared inbox. Now, that means that they won't be bothered, if you will, with all the incoming messages from patients. We can simply turn that off. And what that does is it allows our doctors and our clinicians to focus on clinical tasks, and then the staff will receive all the incoming messages. So I've just reconfigured the virtual front desk for this clinic, so that now in the future, only Clara and Jimmy will be notified of incoming patient messages. Now I can take it a step further and I can entirely turn off the inboxes for Dr. Crichton Brown and Fauchard so that no one can send them messages. And then the user experience for someone who does try to send them a message will be simply to say, this message is being sent to Dr. Fauchard's staff, much like a phone call would be, and then someone else will handle that message for them. Now, having said all that, Dr. Fauchard and Dr. Crichton Brown can still send stuff out to patients. But because of the routing configuration that I've just put in place, if that patient were to respond back to Dr. Fauchard, well, guess what? That message goes back into the shared inbox and gets managed by the team. So in every situation, we can keep the communication routing through the front desk, which is how 99% of clinics prefer to do it. Anyway, I think I've gone over my time. So Jeff, I'll turn it back over to you.
Great, thanks, Mark. Let me wrestle control back over here. And so, as I said at the beginning, we're going to talk about some additional resources really quickly, just so you can, where to get stuff you need. You can send us a list of your patients. So Mark showed you the process for inviting a patient. If you want to skip that manual step for every patient, we can import your list of patients. They'll receive an invite just like they normally would. The big difference is you don't have to do it 700 times. We can do that for you. If you have their email address and their date of birth and their names, we can take that and get them invited for you, so they're already in the system when you go to communicate with them. We do have free training online, so you can either register for a SecureMail webinar to get more in depth. So we'll take a lot of the content, some of the content from that demo, get really detailed in sort of workflows, how to use different features and functionalities, where to access all the different tips and tricks for SecureMail. It takes about an hour. And you can also take that through your SecureMail account now. So there's a little training tab on the left. And if you click on that, it'll take you to SecureMail course. You can go in there. It does give you a certificate at the end. So for any sort of professional designations, sometimes you can get CE credits for those. But for sure, it does give you the credibility of having awareness of how virtual care works in a clinic and how to implement that. So it definitely is helpful for everybody. Now, looking at the big question we all have is who are the winners? So the winners of the draw today, for most secure messages sent, that goes to Emma. So congratulations for that. Most secure mail invites, so getting more people in the clinic in terms of patients as well as other providers, that goes to Ross. And for participation, for showing up today and listening to this webinar and learning something new, that goes to Katie. So congratulations to our winners. Let's keep your practice protected. So you can take a privacy breach protection quiz on our website. If you go to brightsquid.com, just a little bit down the homepage, you can fill a quick survey. It's 7 questions long, multiple choice, takes about 35 seconds. That will give you a score on where you rate in terms of having breaches kept out of your clinic. And we can help you based on that score get better at keeping breaches out. So feel free to do that at any time. We do have a couple quick questions, Mark. We have about half a minute left. What about pricing for SecureMail? How does it work for people that want to upgrade their account if they're still a free user?
Right. So pricing is based on clinicians within the practice. It's a monthly subscription, so there's no long-term commitment, and the price is $39.99 per month. And that allows a clinician to set up their practice to send unlimited messages and send invitations, as I did, and additional staff members, that is to say support staff like Clara and Jimmy from my demo, are available at no additional charge under that $39 license.
Yeah, great, perfect. And real quick, what about reminder systems, appointment reminders? Are those compliant? How does that work with re-engagement?
Oh, I only have 10 seconds to answer this, and I'm not sure that's enough, but I will say this. Reminder systems are great for reminding patients that they have an appointment. And that's certainly legit under HIPAA compliance regulations. However, what I've seen happen more than once is patient reminders become more than just, hey, we'll see you on Thursday. It becomes, hey, we'll see you on Thursday for your extraction. And all of a sudden, we've inserted a little bit of patient healthcare information into that reminder. And if that's sent through a non-compliant system like traditional email or SMS, that is potentially a breach of patient health information, and you need to be very cautious about that. So the long and the short of it is, anything you send through Brightsquid Secure Mail meets compliance regulations. That's often the better way to send those reminders.
I will point out very quickly here too, Mark, in some cases, even just that I have an appointment at your clinic can be private information. We've seen cases in the news where, spouses that are in the course of separating, people being served papers at the clinic because they found out they were going to be there. Different scenarios like that can be problematic from a privacy standpoint, and obviously cause problems with your patient relationships, but also do certainly impact the compliance of your practice. So anything like that you'd want to be careful about as well. So that brings us to our end today. Thanks, Mark, for getting us through the demo. Thanks for tuning in. And if you have any questions at all, always please contact Mark and his team at support because they're always happy to help. Have a great rest of your day.
Have a great day. Bye-bye.